And all right, it is indeed a pleasure to continue having you on Smart Means Business. My name is Joram Paul Songo here with Rita Cabanyoro, and this is SMB Smart Means Business, where we definitely keep you up to speed with relevant information regarding what is happening across the business world. All is what you get from your day Kickstarter, a show that is dedicated to make sure that we continue to drive your business. As a matter of fact, this time around, we are going to look at dental healthcare awareness and what is what are those crucial parts or points that you really need to know about dental healthcare, about anything to do with the healthcare part of the dental. And in most cases, I do remember back in times whereby people would, in primary, well, we could kind of have some games and someone tells you, Joram, I want to see that dental formula of yours. And this is where we're going to have a very serious discussion regarding dental health. And from a dentist, from an expert coming in from that particular angle when it comes to the health sector part of it. And on set with us, joining us, is Dr. Juliet NALUBULA. Many thanks for joining us.
Thank you for hosting me.
All right. Welcome to Smart Means Business, and here we are dedicated to make sure we inform people on matters regarding business. Let's kickstart it off with the inspiration. Where do you get the inspiration on dental health, and why in the health sector did you choose to go for the dentist part of it?
Yeah. Thank you very much. As a child growing up, I went to a single school, Mary Hill High School, which was in Imbara. So going outside to visit a dentist was on appointment, and it took like 2 months, a month to book an appointment with the dentist. So I got to get a dental problem, and it was really painful, and I had to wait 2 months to get a dentist to look at it. So when I got to the dental clinic, I started asking so many questions. I was like, isn't there any dentists around that others would book us in? I was really angry. And the gentleman told me, this is a rare profession and I'm the only one on this street. So I have many bookings. So I was like, how can I do it so that other people don't go through this pain? And maybe I study to be one. Then he just laughed and he's like, you're a lady. This is a man's job. So that motivated me. Okay. I became a dentist.
You picked the motivation.
Yeah, like the statement, I mean, she just mentioned someone, just putting a gender best around there, like you're a lady, it's for men. Yeah. Even me, I would want to say, okay, I can prove you wrong. I'm going for this.
You're going for that. Yeah. Okay. Does it come easy owning a dental care, or let's say farmers, or I don't know, is it also called a pharmacy?
Dentistry is kind of wide.
Okay.
Because dental doesn't only deal with treatment. It deals with education, it deals with laboratory, it deals with products. So if you are going into a dental business, you have to really be particular. Okay. What are you going for? Okay. If you're going for a dental clinic, you have to be a dentist or someone who is into a dental profession. If you're going into like for production, you have to be a good marketeer and know how to sell your things to the dentists. Then if you're going into as a lab person, you have to have some idea, or you have to have a lab technician on hand.
Okay, and maybe why should the public care about dental health? Should I care really?
Yeah. The opening of your whole body is your mouth.
Okay.
So whatever is in your mouth is exactly what is in your belly. It's in your lungs, it's in your kidney, it's in everywhere. I have currently been doing a study. I am doing my criminology and psychology at University in London. So I wanted to really research and find out, why am I really very important? You know, when you're doing psychology, you have to find yourself. As a dentist, how am I important to the community? And then I realized, I had a study from Dr. Stephen Gandry. He's a cardiologist. He said that when he was treating patients of the heart conditions, most of the diseases that caused cardiac arrest, he noticed that the bacteria that was common in people's hearts that time was very similar to the bacteria that is found in between people's teeth. Meaning, if you don't floss and there is accumulation of that bacteria in between your teeth, chances are that if it accumulates and you become old, you can easily get a cardiac arrest. Read about it. He's a cardiologist called Dr. Stephen Gundry. Another person that took my interest was Dr. Peck. Those are current researchers of 2020, 2021, and this is COVID time. This is another researcher called Dr. Pamela Peck in America. He also researched and she found out that, you know, our bodies will react to what we put in our mouth.
Okay.
So exactly what we eat. And where does it pass?
The mouth.
The mouth.
Yeah. So what is
it's the opener of the body, like you said. Okay, I tend to agree here, really.
So even when you're trying to disseminate information, you use your mouth.
So imagine you had a bad breath and you have to communicate.
It's a quick turn off in most cases.
And then does it, you know, talking about the mouth check, does it have to be a routine program for me to go for a checkup? I mean, check my mouth. Does it have to be a routine?
Yeah, of course. Once a year, every person on this planet Earth needs to visit a dentist, which makes it one of the most wanted businesses in the world, but ignored by society. Because if we are 42 billion people in Uganda, let me say, like approximately, and each person needs a dentist, how many dentists do we need?
I mean, 42 million again.
Exactly, to make it easy. But you can find of recent, we don't even have 10% of that.
Okay.
So meaning that if you have an area and you call yourself a successful businessman,
Okay.
and you walk around where you live, where you call your spiritual home, where you built your house, and you walk 10 minutes and you can't find a dental clinic, you're not successful. Because you've not contributed to the health of that area.
Okay.
A long time ago, our grandfathers used to go to work, to hunt, to make sure if you are a man of respect, you had to be able and value, you had to be able to feed your family, you had to be able to, you had to know the best which doctor, the person to treat your family. Right now it has changed. You have to know the best saloonist,
Who's going to work on your, if it's a man who's going to work on your woman or your wife, or your children.
Exactly. And then you've forgotten to befriend the so-called witch doctors, who are now called doctors, dentists, nurses. Those were the ancient health people. Right now people have ignored them and they've gone for clothes. Even if I don't have a good cloth, but I'm healthy, trust me, I may live longer than you.
Okay.
So that is a business that most investors have kind of neglected. But when you get a dental pain, you remember that, oh, my money doesn't matter.
Exactly.
I need a dental clinic at least 10 minutes to my house, at least. If not my house, at my son's school. There are accidents with teeth. So if we look at those things, then I think we are successful in business and health.
Okay. Let's try to look at the cost of the dental care on one's life.
Yeah.
If you're to look at that, because you're saying it's a business that one who thinks they are successful and they don't know that it's supposed to be in their area, then they're not successful.
Yes.
Let's look at that, the cost of dental care.
Dental care. So dental care, as we know worldwide, it is the most expensive. Why is it expensive? Human life is not cheap. Anything that goes into your mouth, trust me, should be quality if you want to have a quality life.
Okay.
If you want to have a very successful oral health, then you need to have a very equipped dental clinic and an equipped dentist. So if, as we say, a business, a happy, successful business community, if we look at these two sectors, the dentists and then the clinics, how many businesses that employ over 500 people have a dental clinic attachment? You don't have to own it, remember, you're not a dentist, but you can own shares in a company that has a dental premise. So if you really, like a health and business-minded person, especially business-minded person, then you have to mind your health, because health is wealth.
Okay.
So if you're minding your health and you have 500 people with you and there is no health facility at your beautiful building, my friend, you're not successful.
Okay.
So you're attaching success to
Health.
to
Yes.
dental most here.
With dentistry, I have worked for a company when I was in England, because I was in England for the last 10 years. And I was working for most corporate companies. I was working in London. So I was working for a company called Allen and Overy as a locum. So what intrigued me about this company when I went there, it is a law firm that deals with celebrities, with cases that are really high end. But this is like they have like 2-story buildings, because this is a big company, and there are 2 hospitals.
Okay.
On the same building.
Yes. And in the hospital, it's not called a hospital. It's called a wellness center. There is a dentist, there is a doctor, there is a saloonist. People have to look good, like it or not.
Well, good building.
Yeah, there is a gym. There is, I went around this area. I got to it, like, why haven't many rich people thought of this? Because if you know where your worker is going for like treatment, trust me, you know the quality of health they are living. Because yourself, that is your doctor.
Okay.
If they're telling you to feed on greens, trust me, they're telling your worker to feed on greens. If I'm checking for your workers and I'm working on cleaning their teeth, trust me, I'm cleaning yours too. So you're sure when you're talking to people, you're like, this is a healthy group.
Okay, maybe if you could now make us understand it more insightfully about dentistry, because you said that it is a lot. Maybe if you could try to break it down for us to understand it.
For someone to know what does
dentistry
really mean.
Okay, dentistry, dental care, it's, you can say, oral health care.
Okay.
This is the care of your oral environment, your mouth. When you open your mouth, there is a certain environment there, the way you see we live here. So meaning there are microorganisms living there, there is water, there is air, and if any of those things are not in that place, then you shall count it dead. So if you're dealing with the dentistry, we are dealing with the teeth themselves, we are dealing with the gums, we are dealing with the tongue, we are dealing with other soft and hard tissues in the mouth.
You're sloping back to the heart as well?
No, it's just still on top.
Okay.
I'm still in the opening.
Okay.
Because if we are dealing with dentistry, we are going to look at cavities. What brings up cavities? Cavities are brought about for what we eat. Acidic drinks, sugary drinks, and not taking care of things whereby you don't clean out the sugars, you don't clean out the acids, you don't alkalize the acid. So if you know those few things, then you can easily know how to manage really your oral health.
All right. You said you've been in England for 10 years.
Yes.
Speaking of that, how have people on the African continent adopted this idea of dentistry here on the continent generally? Because when you look at that, it may not be here in Uganda, but maybe some other countries have adopted it quite faster. I have been lucky when I pass from Nairobi when I'm coming to Uganda. So I sometimes stay in Nairobi and have friends who are practicing there. And you notice that the ignorance when it comes to oral health, by the way, it's not even only in Africa. It's around the world. In England, they are trying to really make sure people are aware of the oral health and they are aware of their oral hygiene and trying to market oral related things as of current. It has not always been like that. Because when I moved there myself 10 years ago, I was able to get a job without having papers because that was a short list occupation, meaning there were few people who are dentists or practicing there. So meaning everywhere in the world there is still that need for people to be educated. We have very good dentists out there, but most of them are seated in the clinics and the patients are not coming. Why? Because the patients don't know they need it. Because if I don't know I need to come to you, there is no need for me to look for you. So the best way to start encouraging people to invest in dentistry, to visit dental clinics, is by educating.
coming out like me. Because in England, I had a very good job and I was getting like over a good money. But then I thought, I was like, money is good. Yes, I'm loving it. But the education, when even you're teaching a person who is a doctor, a lawyer, a minister about oral health, they are very ignorant. And these people are grandfathers, these people are fathers. So what kind of generation are they left home? If personally I'm not aware of my own oral health, then what am I going to tell my child? So I was like, no, if I cannot start from England, whereby my English might not be as good as I can understand it, at least I can go back in Uganda. First, I can speak Luganda, perfect.
True.
I can gamble Nyankole Rutoro, I can do all that. I was like, let me go, they will listen. So I started my Facebook campaign when I was still in England in 2013. So I started talking about teeth. Every Facebook person I would befriend, they're like, oh, why is she talking about teeth? It's not important. Then I would really go into details, and people started noticing there is importance to keep your teeth clean, importance to mind how your teeth, you might be very shy, but because your teeth look bad, that's what is causing your confidence. You might be a bad businessman. Just because your teeth are bad, you can't even pitch yourself properly. Because you're very shy, you're trying to talk, you see people smiling. And even families, some people have been called ugly. Trust me, you change someone's oral health and it's a presence. True.
And speaking of teeth, let us now dive deeply onto teeth. How best can I take care of my teeth? How can I maybe wait on them? And then we have had people who have seen people with teeth guards putting in gold. Share with us now teeth health. How safe is that artificial? I don't know if it's artificial. You will tell us. And and also how can I take good care of my teeth? Routinely, even how?
Even daily, because with everything, even I think you guys are good with business. I'm not so good with business. If even in business, I think what you do every day can matter to what your business will look like 10 years, I think.
True.
So personally, when I'm educating people, because I have a blog, I've done blogs, I've done vlogs. I have YouTube, which is Musawa Julie. I have Facebook. You go, you read. I will go from day to day. When you wake up, when you sleep. So for people watching Smart TV, for the use, try this and you'll see a difference in your oral health. Please try this. Let's wake up in the morning together. When you wake up and you stretch, I know most of us rush and brush your teeth.
Yes.
Most probably.
Yes. That's me here.
No. When you wake up in the morning, please first do some exercises with your jaw. This is 12 hours.
With my jaws?
Your jaw has been in one place for 12 hours. So wake up, do the up, side by side, on the lower. Do that. Do you know what you're doing? You're straining your muscles, meaning you're fighting with aging.
So, but you've not tried that. I have not seen you try that.
No, I have.
Your mouth can't move.
You can make the oil and move around. That is the first thing you do, because now you're fighting age. You have to fight aging, even if you have to look it, but you have to. It doesn't have to look you. And then also your health. Afterwards, try do some exercises, please. Even if it means stretching for your oral health, I'm coming to that. Please do exercises. Because if you're not doing exercise, imagine you have a tree and the whole down part is all dead and the top part is the alive part. You're not living a good life. Because if your whole body is stiff, you're not having a good health down. Your head, trust me, you're not doing a good job. Do exercises, then eat. I know.
Everyone eats.
No, some people first brush, then they eat.
My routine
we're still on the routine of we're still on the routine.
First brush and then take some more water.
That's also very good. But in the morning, the best is if you feel filthy, you're angry with your own mouth, you're like, nah, it's dirty, it's my mouth. Get some water, gargle, spit it out. Then eat. Eat as much as you can. Then after you've eaten, you're sure you've had enough to eat, go and brush. Why? You're removing the food that you've put on your teeth in the morning before you get out of your house. Instead of you brushing, then you eat, you're leaving it, and then you have it the whole day until you come back to brush again.
Is that going to work in some situations? Okay.
Yes, so if we do that, we are happy now. The thing is, the toothpaste you're supposed to use is supposed to be fluoridated toothpaste, meaning it has some effect of fighting some cavities that are starting in your teeth.
Okay.
So what people do nowadays, I know most of us are culprits, is you put the toothpaste, brush, put water, spit it out. You've done nothing. You've not helped the toothpaste do its job. It's fluoridated. It's supposed to put some nutritions onto your teeth. So you remove it before it does anything. Hold on. After you have brushed and you spit, do other things. Watch the news, watch Smart TV, do something.
Do what Smart 24.
Leave the foam in your mouth for some time for the toothpaste to do its job. Then when you're rushing out of the house, the last thing you can do is rinse. If you're that person who you can drive, or you're in a border, you have your earphones on, please, you can rinse from work. When you're entering office, put water, rinse, enter. If you're entering school, rinse, enter, because you've given the fluoride enough time to work on your teeth. Then every time after you leave home, every time you snack, because some people have receipts, some people have some Coca-Cola, people snack on different things. Every time you have a snack, when you're buying a snack, buy water. Buy a snack, buy water. Why? You have to wash away the sugars and the acids. Immediately you take them. So, and then wait for lunch. If you are this health person that you want to live for another 200 years, then carry your toothbrush with you. So that at lunchtime, after you've had your meal, you do the same thing, leave it on before you go back for work, rinse, and then do that. But if you know that person, many of us who don't even carry a toothbrush, so just gargle after lunch, have water. That's why they say.
Should it be warm or cold?
What is favorable for you?
Okay.
Because very cold water, scientists have their own theories, and then very cold. So just research what is good for your health. Really, take your health really personal.
All right. With that, we're going to take a short break. But when we do return, Dr. Juliet is going to take us through the innovations that are out there in the dental world, more so the tooth guards. The teeth guards, how effective are they? Are they risky? All that coming up later after this break. And we shall also look at when does one need a dental check, and because we've now realized it's very vital. Just stick around with us. We will have more of these discussions after the break.